Welcome to a digital presentation on the risk factors for the development of heart disease and stroke, brought to you by the Heart and Stroke Foundation of New Brunswick. The Heart and Stroke Foundation of New Brunswick is a volunteer-driven health charity with a mission to prevent disease, save lives, and promote recovery. Together with the help and enormous generosity of the people of New Brunswick, who have allocated more than $24 million over the past 34 years, we have enabled research breakthroughs in science and technology and developed a multitude of health promotion, resuscitation, and recovery support programs. More than any time in our history, people are surviving from heart attacks and stroke, and people are living longer lives. However, a 2013 report on the health of Canadians shows a 10-year gap exists between how long Canadians are living and how long they live in good health. We would like to see that gap shrink, seeing more people living happier and healthier into old age. How is that possible? Well, in order to reduce the risk of developing a chronic disease, such as heart disease, New Brunswickers can focus on making small lifestyle changes related to what we call the modifiable risk factors. Modifiable risk factors are risk factors that can be changed or treated in order to reduce the risk of disease. In contrast, non-modifiable risk factors are risk factors that you cannot change or control. The 5 major non-modifiable risk factors for heart disease and stroke are your age. As you get older, your risk of heart disease increases, and although strokes can occur at any age, most strokes occur in people over 65 years old. Your gender. Men over the age of 55 have a greater risk of heart disease, and until women reach menopause, they have a lower risk of heart disease and stroke than men. Your family history. Your risk of heart disease is increased if a close family member, a parent, sibling, or child develops heart disease before age 55, or, in the case of female relatives, before menopause. Your risk of stroke is increased if a close family member had a stroke before the age of 65. Your ethnicity. First Nations people and those of African or South Asian descent are more likely to have high blood pressure and diabetes, and therefore are at a greater risk of heart disease and stroke than the general population. A prior stroke, or TIA, which is a transient ischemic attack. If you've had a previous stroke, or TIA, which is also known as a mini-stroke, your risk of stroke increases. As we know, we cannot control our non-modifiable risk factors. These are simply facts of life that we should be aware of when assessing our own risk of heart disease and stroke. But luckily, there are certain factors related to our behavior that we can change in order to reduce our risk of many chronic diseases and, in turn, increase our chances of living in wellness longer. As mentioned earlier, these are known as modifiable risk factors. There are 9 modifiable risk factors for heart disease and stroke that I will go over today. The more risk factors you have, whether they be modifiable or non-modifiable, the greater your risk. So listen up and take notes of which ones may apply to you. Smoking. Smoking is the number 1 risk factor for cardiovascular disease. Exposure to secondhand smoke can also have many negative health effects that increase your risk of developing heart disease and stroke. Smoking contributes to the buildup of plaque in your arteries, increases the risk of blood clots, reduces the amount of oxygen in your blood, increases your blood pressure, and makes your heart work harder. Being smoke-free has enormous benefits for your health and the health of the people around you. The sooner you become smoke-free, the sooner your body can start to recover, and it doesn't take long to see the effects. Within 1 year of quitting, the risk of dying from smoke-related heart disease is cut in half. High blood pressure, otherwise known as hypertension. High blood pressure is actually the number 1 risk factor for death in the world. Knowing what your blood pressure numbers are and consulting with your healthcare provider to ensure that your blood pressure is normal or controlled is important. A low blood pressure reading is below 120/80 milliliters of mercury, When blood pressure consistently measures over 140 over 90 milliliters of mercury, it is considered high. For people with diabetes, a blood pressure that consistently measures 130 over 80 milliliters of mercury is considered high. It is important to keep your blood pressure in a healthy range. Being overweight. Body mass index in combination with waist circumference is considered a good measure for assessing the risk of weight-related health problems. Although the body mass index is useful for creating guidelines for healthy adults aged 18 to 65, it does not apply to infants, children, adolescents, pregnant or breastfeeding women, older adults over the age of 65, or extremely muscular individuals. Body mass index is calculated by dividing your weight in kilograms by your height in meters squared. A body mass index of greater than 25 is considered overweight, while a body mass index of greater than 30 is considered obese. People who carry excess weight around their middle are at a greater risk of health problems. In general, if you are a man and your waist measures more than 102 centimeters or 40 inches, or a woman and your waist measures more than 88 centimeters or 35 inches, you are at increased risk of developing health problems such as heart disease, high blood pressure, and diabetes. Physical inactivity. People who are physically inactive are twice as likely to be at risk of heart disease and stroke than people who are physically active. Active living is important to maintain good heart health throughout your life. To achieve health benefits, adults aged 18 to 64 years old should accumulate 150 minutes of moderate to vigorous intensity aerobic physical activity per week in bouts of 10 minutes or more. If you have been physically inactive, talk to your doctor before starting a physical activity regimen. Stress. Although stress can sometimes be a good thing, like when you are planning a trip or hosting a party, too much can actually harm your health and increase your risk of heart disease and stroke. What is stressful to you may not concern someone else, because no two people respond exactly the same way to a situation. To cope effectively, you need to recognize stress and how it affects you, and ask for help if you find yourself having a hard time dealing with your life stresses. Diabetes. Diabetes increases the risk of high blood pressure, narrowing or hardening of the arteries, coronary artery disease, and stroke, particularly if your blood sugar levels are poorly controlled. If you are 40 or older, have a family history of diabetes, have high blood pressure, high blood cholesterol, or are overweight, ask your doctor to test your blood sugar levels. High blood cholesterol. In most cases, high blood cholesterol does not produce symptoms. The only way to know if you have high blood cholesterol levels is to have your blood tested. Not sure if you should be concerned about your cholesterol levels? Ask your doctor. Canadian guidelines recommend having your cholesterol tested if you are a male and are over 40 years of age, are female and are over 50 years of age and/or postmenopausal, have heart disease, diabetes, or high blood pressure, have a waist measurement of greater than 102 centimeters or 40 inches for men, or 88 centimeters or 35 inches for women, smoke or have smoked in the last year, have erectile dysfunction, or have a family history of heart disease or stroke. Atrial fibrillation. Atrial fibrillation is a condition involving an irregular heart rhythm, known as arrhythmia. It is the most common type of arrhythmia, affecting approximately 350,000 Canadians. Generally, the risk of developing atrial fibrillation increases with age and with modifiable risk factors, such as diabetes and high blood pressure. One of the main complications of atrial fibrillation is stroke. Individuals with atrial fibrillation have a risk of stroke that is 3 to 5 times greater than those without atrial fibrillation. Some people with atrial fibrillation may feel perfectly fine. Others may experience various symptoms, including irregular and fast heartbeat, heart palpitations or rapid thumping in the chest discomfort, chest pain or pressure, shortness of breath, particularly with exertion or anxiety, fatigue, dizziness, sweating or nausea, or lightheadedness or fainting. Your doctor can test for and diagnose atrial fibrillation. Excessive alcohol consumption. While you may have heard that alcohol, particularly red wine, is good for your heart, drinking too much of any type of alcohol can increase your blood pressure and contribute to the development of heart disease and stroke. If you drink, limit yourself to 2 drinks per day to a weekly maximum of 10 for women, and 3 drinks per day to a weekly maximum of 15 for men. If you don't drink, don't start. Of course, the best story is one in which heart disease and stroke do not happen at all. And the fact is that up to 80% of premature heart disease and stroke can be prevented. Now that we've gone through the non-modifiable and modifiable risk factors, you should know which ones apply to you. So what's next? One of the things you can do is visit the Heart and Stroke Foundation of New Brunswick's website at www.heartandstroke.nb.ca. Click on the Health eTools tab to take the Heart and Stroke Risk Assessment online and get a personalized risk profile and customized action plan for healthy living. Your plan includes tips, tools, recipes, and much more to help you reduce your risk. There are also a variety of other heart and stroke e-tools available. These easy-to-use e-tools can help you lead a healthier life. You will be able to set and achieve goals to manage your blood pressure or achieve a healthy weight and keep track of important details such as medications and appointments. Sign up for any or all of the e-tools depending on your needs. Thank you for listening to this digital presentation brought to you by the Heart and Stroke Foundation of New Brunswick. Remember, you have the power to make lifestyle changes in order to reduce your risk of heart disease and stroke. For more information and to order pamphlets, please feel free to contact us.